तो चैप्टर 7 गायनी का फाइब्रॉइड्स। तो सबसे पहले देखो, फाइब्रॉइड्स जो होते हैं वो होते हैं स्मूथ मसल में ट्यूमर्स, बिनाइन ट्यूमर्स होते हैं। और फीगो स्कोर में अपन आएंगे 7 तरीके के फीगो, 8 में एक्स्ट्रा स्पेशल केस है। लायोमायोमा बोलते हैं इनको, और ये 3 तरीके से हो सकते हैं। मोस्ट कॉमन होते हैं इंट्राम्यूरल, फिर जो 60% केसेस में होते हैं, फिर होते हैं सबसेरोसल, और फिर होते हैं सबम्यूकोसल जो 10% केसेस में होते हैं। और वही ये 25% ऑफ फीमेल्स रिप्रोडक्टिव एज ग्रुप में जो उनको होंगे, और 40 के बाद ऑलमोस्ट 45% फीमेल्स को होंगे, है ना। एसिमेट्रिकली एनलार्ज्ड यूट्रस जो होता है, एक तरफ से बहुत बड़ा हो गया अगर कोई फाइब्रॉइड, तो उसको बॉसिलेटेड अपीयरेंस बोलते हैं, ठीक है। मोस्ट सिम्टोमेटिक कौन से होते हैं? सबम्यूकोसल, जो मतलब सबसे कम है वो सबसे ज़्यादा सिम्टोमेटिक है, सही बात है। इसके रिस्क फैक्टर्स क्या क्या है? नली पेरस फीमेल, और इंटरेस्टिंगली दिस इज द फ्यू केसेस इन गायनी वेयर smoking cigarettes help. I mean, the smoking is protective factor for leiomyoma, and this tumor has whorled appearance, smooth muscle spindles covered by a local compressed myometrium or pseudocapsule, and these smooth muscle fibers has estrogen and progesterone receptors in them, and supplied by blood. Types of degenerations that occur for these tumors to grow are: most common is hyaline degeneration, most common in menopausal patients, atherosclerotic, cystic degenerations, and calcified degenerations, and red degenerations or carneous degenerations. Mm. There is no need for antibiotics, myomectomy, and MTP for red degenerations. Sarcomatous degenerations are the rarest, 0.1% seen in postmenopausal women, which increases the size of uterus and are accompanied by acute pain. Now, FIGO classification. So, actually, I need to draw this one, or you can see right here. FIGO 1 is pedunculated or hanging to the inside of uterus. FIGO 1 is more than 50% inside the uterus cavity. FIGO 2 is more than 50% inside the uterus wall or myometrium. FIGO 3 is completely inside the myometrium and not touching the cavity. FIGO 4 is touching the outer cavity or uh, and does not touch the endometrium. FIGO 5 is more than 50% inside the uterus and a little bit outside. FIGO 6 is more than 50% outside the uterus and a little bit inside. And FIGO 7 would be pedunculated outside the uterus. FIGO 8 is a rare case which is accompanied by a group of rare fibroids or cervical fibroids, broad ligament fibroids, parasitic fibroids. And if a fibroid is large enough, as you can see here, this is called fibroid 2-5. It's not a second to fifth fibroid, it's fibroid 2-5. Now, clinical features. So, most of the females who have fibroids are asymptomatic, 50% plus. So, if the patient is asymptomatic, we don't need to give any treatment. And the most common symptom is AUB. AUB means, we'll see it someday, just not here. I'll just give in description. Second most symptom is pain. Pain can be cyclic in dysmenorrhea, acute abdominal pain, torsion, red degenerative and sarcomatic degenerations, and chronic dull pain in other degenerations. Other symptoms can be lump in abdomen, recurrent pregnancy loss, infertility, pressure symptoms. Investigation of choice would be USG, obviously, which shows enlarged uterus, well circumcised region mixed with echogenicity. MRI would be more accurate but rarely required. Saline infused sonography or sono HSG, saline infused sonography, is best sonography for submucosal pathology. And also, saline infused sonography, we fill the uterus with saline so we can see tubal patency with this. And Hysteroscopy is diagnostic plus therapeutic for FIGO 1 0 pedunculated and FIGO 1 more than 50% outside. If there is 0 or 1 FIGO plus symptoms plus any age, we would do hysteroscopic myomectomy. And management of fibroid uterus, if entire uterus is like fibroid, if there are no symptoms, no need to treat. As we said earlier, symptomatic patients are the first line. So if the patient develops some symptoms after fibroids, so first line investigations would be decreasing the symptoms. What could be mefenamic acid, NSAID, COC pill, or combined OC pills, and which decrease the menses, and Mirena pills. And there would also be the pills of tranexamic acid, which is anti-fibrinolytic. And to decrease the size of the fibroids, we would decrease the blood supply to uterus, which would be like danazole, which is androgenic anti-E receptor, mifepristone anti-P, ulipristone, GnRH analogs. We could give GnRH injections or gonadotropic releasing hormone injections, continuous agonist or antagonist. Most common side effect would be hot flashes, which is common for estrogen to do. Add back therapy is mandatory. 10 micrograms of estrogen would be given. If medical management fails, do a minimally invasive or non-invasive procedures to remove it. And so the minimally invasive procedures will be uterine artery embolism to cut the blood supply of the fibroid, endometrial ablation therapy, so we'll just heat kill the tumor, or HIFU or high intensity focused ultrasound. For this exact location, fibroid MRI is used and is very dangerous. So these all procedures are only done if the patient has completed his or her family. Obviously, surgical management would be myomectomy under 40 years, and if the patient want to have family further, and more than 40 years, or patient want to not have family further, then we do hysteroscopy, entire uterus is removed.